Hello everybody, Dr. Sharon Wong here. We're going to be talking about moles today, which is a really important topic. In our skin we all have what we call melanocytes, so these are cells that help us produce pigment and give us our skin colour. Occasionally those melanocytes cluster together in a very small area and create moles. When do we need to be concerned about moles? When could it signify that there's something a little bit more serious going on? So we often talk to patients about the ABCDE rule, and that's the acronym that we use to help patients to start looking and checking their moles for any potentially serious changes. So if we run through each of these, A is for asymmetry, so if the mole is looking different on two halves, so if you draw an arbitrary line across it, do the two halves look the same or is it a bit asymmetrical? B is for border, so if the edges of the mole are not very well distinct and it's sort of blurred into the background skin. C is for colour change, and certainly if there are two or more colours in that mole, it should be checked. D is the diameter, and normally the cutoff is about 6 or 7 millimeters, so if you have larger moles than that, which of course if they are increasing beyond that size should definitely get checked out as well. And more importantly, E is for evolution. So what is changing? So are those other parameters like the colour, the diameter, are they changing over a short space of time? If that is the case, then you must go and see your GP and or your dermatologist. So if your GP or dermatologist feel that this particular mole could be something suspicious, they will arrange for this to be cut out. And this is not a major procedure. It is undertaken as a local anaesthetic procedure. Usually only takes about 15 to 20 minutes to remove a mole, and that is the most important thing, is to get that mole out of the skin and analysed. Sun protection is the most important thing that you can do to help yourself reduce the risk of any mole changes and potentially skin cancer. It is important to choose the right sort of sunscreen to use. Most people will go for quite a low factor, but really if you're going to be very good with your sunscreen, you need to be choosing something that is high factor and broad spectrum. So high factor meaning SPF 30 or 50, and broad spectrum meaning that it covers UVA and UVB. SPF only means that the product covers UVB. In order to be broad spectrum, you also need to cover UVA. And that you will see as a little round blue logo with a star rating, and you need to go for a product which is 4 or 5 stars. Even if you are choosing the correct product, most patients are actually not using the sunscreen correctly. Most people probably put it on in the morning and then not again until the following morning. And actually, manufacturers can only claim the SPF or UVA rating based on the understanding that you are applying it every 2 hours. So unless you are putting it on every 2 hours, and even more frequently if you're in the water, if you're sweating a lot, then that SPF factor and UVA rating is not applicable. A common myth is that skin cancers or melanomas can only arise from moles which were there beforehand. That is not the case. So 20% of melanomas actually arise from what we call de novo, meaning that it is from a brand new mole. So do be aware of any new moles that appear on your skin and watch them carefully.